am a biological dentist practicing in Louisville, Kentucky, and I'm a member of the International Academy of Oral Medicine and Toxicology, which is a very long name that we all abbreviated to IAOMT, which is an organization, it's a nonprofit organization. It's been around since 1984, and I was one of the early members as a charter member. We have 2 meetings a year, which we gather together as many of our members as possible. They've become quite successful, and these 2 meetings a year, we educate each other and have speakers come in who are very well trained and researchers, knowledgeable to educate biological dentists about maintaining our patients' health, maximizing, making them for optimal health, avoiding materials that not everybody, but a lot of people now realize are toxic, like the mercury fillings, avoiding fluoride, particularly added to the water, and problems with root canals. So we covered that whole gamut, and like I say, keep up with the latest advances and research in the field. And then we take that information and share it with others, and mainly our patients. And we've been working hard to enhance our website as well as our social media activities, launching various campaigns, most recently our fluoride campaign, which we put together. We have a major position paper, but then within that we have smaller documents that we broke out to make it a little more readable for folks that don't have time to read a 50-page document. And so we're getting the word out and gradually making a difference in the world. About a year ago, we launched our new certification program called SMART, which stands for Safe Mercury Amalgam Removal Technique. And we have found that, unfortunately, a number of people haven't really given the respect to that removal process that it deserves, meaning that as soon as the dentist drill touches the mercury filling to start drilling it out, removing it, that there's an immediate or major release of mercury vapor as well as particulate from the amalgam, which increases exposure to mercury. That creates an invisible, odorless, tasteless cloud that can contaminate that whole dental office operating room, as well as the patient and all that. So the protocol covers a lot of information. We have a brochure that spells out the details, but it's also on our website. We have a special website called thesmartchoice.com, which just focuses only on the safe removal of the mercury fillings and spells out the protocol. We have a video on it where patients can see exactly what's involved with following the protocol, and even dentists can educate themselves. But like I said, we do have a certification process, and it's, amongst other things, it helps to ensure adequate communication between the patient and the dentist, to where the patient can understand exactly how they will be protected and that the patient's expectations can be met. Because in the past, there might be some dentists, for whatever reasons, that would take some shortcuts and not provide optimal protection to the patient, which is really what we're all trying to achieve. Optimal protection not only for the patient, but then for the dentists themselves and their staff. And that's a very important aspect of protocol. And it's very important and crucial that we all communicate very openly and exchange our ideas and information so that we can better understand and appreciate this complex puzzle of human health and how to optimize human health in our patients in a way that's as efficient as possible, as cost-effective as possible, and with as least trauma as possible. Some aspects of healthcare, particularly when it comes to dentistry, people have had, unfortunately, some uncomfortable experiences maybe in their childhood years, and so as a result, we need to recognize that and realize that when we engage our patients, that we need to talk through some old traumas, because sometimes the goal is to get rid of some of these toxins that are in the teeth. Sometimes the teeth themselves have become toxic to where they need to be removed, like in the case of abscessed teeth or root canals. And some patients, that can be very stressful to go through the whole process. And so we always keep that in mind.